We welcome Dr. SIVUYILE Madikana, who has been working on the front line during this pandemic. We chat to him about COVID and how we can continue to stop the spread. Doctor, welcome to Afternoon Express.
Hi, Bali. How's it going?
I'm good. You know, it's so funny being able to talk to people that are considered friends over the time in such a professional way, because you are a doctor, you're a medical professional, and you know everything that's been happening on the front line, behind the scenes, and that's essentially what we want to touch base on today. Now, Dr. Madikana, I mean, it's been quite a journey these past few months, and the country now is on lockdown level 1. We've become accustomed to living with COVID, but many are experiencing that COVID fatigue, where of course we're not taking the precautions we used to. So how careful should we be now with more interactions taking place?
Bali, thanks so much for having me. I think what I always tell people is the fact that COVID is going to be with us for a while. So it's not something that's disappeared or going away. We need to be able to ensure that we know how to live with it. It's part of our lives right now. And as I say, it's the new normal, right? So when you're going out on the streets, you know, don't forget to wear your mask. As much as the numbers have reduced over the past couple of weeks or so, and the president has said we can open up the country, but there's still stuff that we need to stick to, such as wearing your mask, sanitizing your hands, because I think, again, it's something that we have found ourselves lacking in the past couple of weeks since level 1 lockdown has begun.
Absolutely. But as a medical doctor, how have you and your colleagues been coping? Now, I'm sure it's been quite a challenging time. And furthermore, we now know that there's an influx of infections, and now the infection rate is starting to drop. So how safe are we?
No, so the infection rate is starting to drop, and that's quite awesome for the country in general and the world as a whole, meaning that the world can open up and things can get back to normal, right? However, doctors working on the front line still need to ensure that they are protecting themselves every single day. And I think it's COVID fatigue, not only from a public perspective, but also from a healthcare worker's perspective, in that they need to make sure that they've got their PPE on and, all the other precautions that they need, So it's still not necessarily something that's disappeared for us as medical practitioners, because that's something that we deal with every single day. If one of our doctors working in the emergency room is getting sick, we need to make sure that we take them out of the emergency room to make sure that they isolate and protect not only themselves, but the patients as well. So it's still something that for us is a full-on reality. And unlike, I suppose, other South Africans where, it's almost at the back of our mind, but as healthcare workers, it's something that's there with us all the time.
Absolutely. And I just have to commend you and your colleagues in this moment. We do not take it for granted. Putting yourself at risk on a daily basis just to make sure that we're safe, alive, and taken care of, we take our hats off to you and we say thank you so much. But now when we hear most people get COVID mildly, how mild is that? And does it have lasting effects, as in some experience symptoms over the next few months?
Bali, as you might know, we call it the novel coronavirus because it's something that is new. It came into the world last year and we're still learning so much about it. So the reports that came to us, when we got our wave of infections, we thought literally you get COVID and immediately you get shortness of breath, you're in hospital, in ICU. But what's tended to happen in a lot of cases, and a majority of the cases, is that people get mild symptoms, right? You might think you have a flu, you might think maybe I don't, where you have perhaps a dry cough, you've got a bit of body pain here and there, and a couple of other symptoms. Some people even have headaches, right? And so they've mistaken those for other things. So it's very mild symptoms because we're expecting this huge flare up where you're really short of breath and you can't breathe properly. But what we found is that the infections are very mild, and a lot of people seem to have that and they don't know that they've got COVID because they don't take those mild symptoms very seriously.
Now, with many people being asymptomatic, how dangerous is it to ignore mild symptoms? And how is inflammation of the organs and our muscles COVID related? What are those signs that we should look out for with regards to inflammation?
So look, I'll start with the discussion around people that are asymptomatic or very mild symptoms. I think it's important that, again, we re-emphasize that to the public, you need to ensure you're wearing your mask, you're sanitizing, you keep the 1.5 meter distance. We need to keep those precautions in place because you don't know whether you've got COVID or not, number one. And then the second part, when it comes to, the inflammatory process, as we know, any infection in your body and COVID as well specifically becomes an inflammatory process within the body. So hence people are getting things like muscle pain, they're feeling tired, because what it does is that it goes into the organs and the cells that, occupy your body, and essentially causing an inflammatory process, causing your cells to tire and wear out, and that's what we're getting.
So we know that we have to wear a mask, sanitize, and keep a 1.5-meter distance. But is that enough? A lot of people are asking, am I doing what's needed? Are there extra precautions that we can do to keep our immune system strong and to help stop the spread?
Currently, we don't have a cure. That's why also we're looking for a vaccine, and those tests are happening and ongoing. Hopefully, we'll have a vaccine very soon. But one of the things that we do recommend from a healthcare worker's perspective, first of all, is, winter's over right now, but what we'd recommended was that people have a flu vaccine, right? So that that if you're getting sick, it's not necessarily just the flu, but it cuts out all the other things, but could be COVID. The second thing that's quite important is that, taking your multivitamins, so your vitamin D, vitamin C, and zinc as well is quite good, because it helps your body build up its immune system so that it's better able to fight any kind of infection, and COVID more specifically.
Now, you have mentioned, Doctor, that COVID is a new virus, and doctors might not have all the answers, but we have heard that healthy people succumbing to this virus, and also we've also heard those people that are vulnerable also succumbing to it. But what treatments then have been effective thus far? You've spoken about a flu vaccine as well. Do you recommend that we do that? Yeah,
definitely. So the reason we recommend people getting a flu vaccine is that you're able as healthcare workers and also individuals to easily rule out what could the causes of the infection be. So someone presents to you with shortness of breath, or someone presents to you, they're coughing, they've got symptoms that might look like COVID, because COVID and also the general flu have quite similar symptoms, in that you'll have a scratchy throat sometimes, you have coughing. So you need to also delineate as an individual, but also as a healthcare worker, that, okay, this person probably could be a flu, this person could be COVID, but taking a flu vaccine early on, prevents you from getting the flu, but won't prevent you from getting COVID. So therefore, we know that we have to be very cognizant that you might have COVID. And when it comes to treatment, as I said, like currently, there aren't any treatments that are out there. What we do is we treat the symptoms that people are presenting with, and definitely recommend that you get your zinc, you get your vitamin D, you get your vitamin C.
Thank you for that. Doctor, again, helping us understand and break down COVID-19. With all this new information, it's very hard to keep up, but that's why it's important to touch base with professionals like yourself. We appreciate it. Enjoy the rest of your afternoon.
Thank you so much, Bali. Have a good one.
With information about COVID changing daily, it's important for us to maintain social distancing, sanitizing, and wearing our mask, but also pay attention to our bodies. For an update on COVID-related information, please do check out our website.